मन की बात। माननीय प्रधानमंत्री श्री नरेंद्र मोदी भारत की जनता से साझा करेंगे अपने मन की बात रविवार 29 मार्च सुबह 11 बजे। आकाशवाणी के सभी केंद्र सभी चैनल इसे प्रसारित करेंगे एक साथ। इसके अतिरिक्त दूरदर्शन के YouTube चैनल और प्रसार भारती के ऐप न्यूज ऑन एयर पर सजीव प्रसारण लाइव स्ट्रीमिंग के माध्यम से। तो याद रखें, रविवार 29 मार्च सुबह 11 बजे मन की बात।
विशाल है ना, इसका सब प्रॉपर चलता है।
कल उसके बैंक अकाउंट में 15,000 रुपए का फ्रॉड हुआ है, पता है?
इसको तो कोई टेंशन ही नहीं होती है, देखना।
टेंशन क्यों? मेरी कोई गलती नहीं थी। फिर भी फ्रॉड होने पर मैंने तुरंत बैंक को इन्फॉर्म कर दिया। आरबीआई कहता है अगर आपके अकाउंट से किसी ने धोखे से पैसे निकाले हैं तो बैंक को जल्द से जल्द इन्फॉर्म कीजिए। 3 दिन के अंदर इन्फॉर्म किया तो कोई नुकसान नहीं होगा। जितना लेट करोगे उतना ज्यादा नुकसान। और सुन, सब चलता नहीं है, प्रॉपर चलाना पड़ता है। आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
Namaskar and welcome to this edition of DD Dialogue. As the world continues to grapple the corona outbreak situation back home in India, the centre continues to firm up and bolster the already existing robust infrastructure, and this is, remember, happening 24/7, every passing second, every passing minute. In this special edition of DD Dialogue, which happens to be our signature show of national broadcaster Doordarshan, we're going to talk about the public health outreach on the sidelines of fighting corona. Particular focus on organizations like WHO and UNICEF. What's their assessment of the way it's been handled and contained by our government, and what are the roles, procedures, SOPs that have been followed by various organizations besides the health ministry, the other verticals like Niti Aayog, etc. And last but not important, but most importantly, the larger import, the message of Prime Minister Modi's national address on COVID-19 on national broadcaster. What was the larger message? And to begin with, in fact, we're extremely honored to have a very distinguished panel on Doordarshan on this special edition of DD Dialogue. We are joined by Dr. Hendrik Bekkedem. He's representative to India from WHO, World Health Organization. Thank you so much, Dr. Bekkedem, for, in fact, I think this is your exclusive appearance and first television appearance since the outbreak of corona crisis here in India. We really appreciate you joining us, and very, very honored to have with us on the show also Dr. Yasmin Ali Haq, UNICEF India representative. Thank you so much, ma'am, for joining us. We really appreciate you joining us, and also extremely glad to have Ambassador Vishnu Prakash joining us on this special edition. Very glad to have with us also Dr. Sachin Chaturvedi, Director General RIS. And very, very honored to have with us Dr. V.K. Paul, Member Health, Niti Aayog. In fact, I'm quickly going to start with the WHO assessment of the way the crisis, in fact, if I may be allowed to use the word crisis here, in terms of containment. Do you think India has been ahead of the curve so far, vis-a-vis the way the situation has been handled by other developing countries? I understand there cannot be direct comparisons, but especially the way we have moved in the last 72 hours.
Thank you very much. I think what has been very clear that India has taken it very seriously from the onset. On the 31st of December 2019, it was reported to WHO that there was a new disease. I think in a very short time it was already discovered that there was a new virus involved, a new coronavirus. And as soon as I think India heard about it, then they started taking it very seriously. What do I mean with this? The Ministry of Health, the Secretary of Health, and the whole team started very, very much looking at the issue. And I think within a few days' time, the Prime Minister and the Prime Minister's office was directly already involved. And I think it has been very encouraging. And what's very important with when you have a threat of a disease, you need to start as early as possible. And for this one, I dare to say, from India started very early in the game, taking it very seriously.
You agree India started very early, yes?
Yes, it's absolutely true. They did not wait for it to become a public health event of international concern, which was at a certain moment declared. It also didn't wait that WHO said it is now a pandemic. And that is very important, because I think if you deal with a virus, if you deal with a disease, then the early part is very important. And for that one, I think we give India highly credit from that he has been mobilizing early, but also having a whole government approach.
Yes.
Not only of the Ministry of Health, the Ministry of Health worked with other ministries, the leadership from the Prime Minister and the Prime Minister's office was also very clearly felt.
Yes, and do you agree with Dr. Beckett, ma'am? And also with that, I want to know from you, there are a lot of challenges now are we really looking at in terms of population density, cultural diversity, economic disparities also to some extent, and especially when we talk about children here, there is an advisory now below 10. They're advised to stay back home, children being more vulnerable to this kind of virus. What is UNICEF's take on it?
So first of all, I'd echo what Henk has just said about the strength with which action had already started in India. And it's really important for us to understand, and I'm sure we're all feeling it, that this is something unprecedented.
Yes.
The experience globally, the way we're seeing events unfold in India, we are trying to battle an enemy that we can't really see in a way. Routine life for children is being overturned in a way. Children are being told, no, you don't go to school. No, you're not going to go out in the playing fields.
And explaining children social distancing, it's
absolutely.
It's
well, you know,
difficult.
when for children that contact and being close is so important. It's also going to be looking at, you know, the challenges you talked about, the disparities that are existing in India.
Yes.
Are we reaching everyone who especially needs to be reached? We know that the virus does not listen to boundaries. It discriminates. It does not discriminate any particular person or caste or ethnicity. We know the elderly are more vulnerable.
Yes.
We know people who have underlying health conditions are more vulnerable, but no one is exempt. It can affect anyone. So that's where it's so important that as a community we come together and look at, all right, what does this mean? How does education adapt? How does health service adapt to it? And we've really been working very closely with WHO and supporting the Ministry of Health in getting the messaging out. You know, washing your hands frequently with soap. You know, not sneezing in open, making sure that if you're not feeling well, go and you run a fever and you have signs of a flu, consult with a doctor. And these messages, debunking all the myths that are out there, it's really important that we continue with that.
Ambassador Prakash, let's also a bit focus about the larger message of the imported Prime Minister's national address yesterday. Highly anticipated, but would you agree one of the highlights was also that nothing was imposed. Voluntarily, the Prime Minister's outreach coming straight from the heart, whether it is curfew for the people, by the people, and very far-sighted approach, as if you have the senior member of the family trying to take control of the situation. In fact, why I'm saying this because I happened to read that first quote from you, the Twitter quote. So that's making some difference on ground. It's been embraced by the people.
Oh, absolutely. We were all looking at waiting for the speech with great anticipation. But let me say, I was not ready for what I heard, what I saw. It was not the address of a national leader, it was the address of a statesman, as far as I am concerned. And in my adult life, I do not recall having heard, seen such an inspirational address, because as you very rightly said, it came from the heart. You know, when the leader of a nation is seen talking about something so caringly, with so much of feel. Now, other than amongst other things, he said, look, there is a vulnerable segment of the society, and please take care of them. You can. They also have families to feed. I think that was caring. The people's curfew or the Janta curfew, I think is one of the very thoughtful moves. It is a full dress rehearsal, so to say, you know, because as my co-panelist said, we are dealing with an enemy that we do not know, we do not see. Here let me bring in Chancellor Angela Merkel, who is a very thoughtful leader, who has in fact gone to the extent of saying that after Second World War, it's perhaps the most biggest challenge the world is grappling with. So when you have a problem of this magnitude, and the leadership is provided up by the Prime Minister, who talks about all the dimensions, he said, look, everybody has to participate. Let us salute those who are contributing.
Yes.
Let us take care. I thought it was a wonderful address, and it has inspired people to voluntarily follow, do what is required, so that we can together try to defeat this huge crisis that confronts the nation.
Okay, and that brings me to this question of dealing with economic challenges. Lot of build-up and lot of anticipation already, Dr. Chaturvedi, is on the ground. We do know, as was also reiterated by Prime Minister, a task force to deal with the economic challenges up ahead, and we are already braced up for that. Now, when we talk about the economic imperatives, I'm going to come to the international scenario a little later, how China and other countries have dealt with it, but on domestic front, what is your assessment?
See, 3 points are absolutely important here. The Reserve Bank of India has already acted, and almost a week back the governor has already announced the measures that are required in terms of readjusting the amount of loans that companies and institutions have borrowed, the rate of interest that is required to be adjusted, the amount of liquidity that is needed in the market. All three have been taken care of, and Reserve Bank is on record. Prime Minister was also very explicit yesterday in his address in terms of supporting the informal sector of the economy, which is the huge component of our economy. So, the job security, the livelihood security, and of course, supply of essentials. So, that dimension of economy is important. We are already hearing various calculations that are coming in, particularly in tourism, the sectors that are related to pharma, but where the supply side disruptions are there.
Yes, yes.
So, that I think is a huge issue, but I was counting first on the sectors where livelihood security is a bigger threat, and tourism is a huge sector. The auto component and auto parts industries that are there, then are the larger supply side constraints which we are facing in across the sectors. So, here the medical devices, the drugs, pharmaceuticals, and I think the effort that is now there in terms of bringing in other parts of the economy, particularly the white goods that we have been importing, or the parts and components that are being imported. So, you see a huge disruption that is likely to happen.
And we have this heavy dependence on China, let's face it. I was coming to that question, Dr. Paul, Member Health, Niti Aayog. I think you, in the last 1 week, Niti Aayog has had several meetings with the pharma representatives, and here, time and again, this question of API, that is active pharma ingredients. I will not get into the technicalities of it, but then the kind of crisis that we are grappling with it. API is an issue, and we don't have to look at the comparison to compete with China, but how are we actually dealing with the situation? Because China was the worst affected few months back, and we need China when it comes to APIs and other drug intermediaries. Are we self-sufficient right now to deal with the situation?
Two levels. One, that the API problem has been somewhat overstated. When we went through the analyses, we discovered that it's okay, there is a challenge, there are going to be problems, there are problems, and China is a major supplier. But when we looked at our capacities and disaggregated the various types of API, the situation is not all that alarming. Having said that, we definitely have to give a boost to our API industry.
And how
we were the
do
leaders. We were the leaders. We have the capacity, we have the entrepreneurial system and people. And that task has been systematically taken up, and an action plan has been prepared, and a stimulus to this industry is being ensured, and plan B are also ready.
So quickly, supply chain is not disrupted. Rest assured, challenges on economic domestic markets front will be dealt with. Are we, I'm going to come to you as well, looking at some specific policy measures that are being drafted, if you could share with our viewers on the national channel, because the country deserves to know, in the light of this anticipation, Dr. Paul, markets are going down, the state of economy might see a further slump. How do we deal with that situation? Sir.
Sachin first.
No,
Tough question.
I think no.
Yes.
I think the efforts that are required, they are already been rolled out. As we all are talking in this room, the finance minister in another room is holding the conversations that are required with all the key ministers, all the key economists have been consulted, and the round of efforts that are required are already on. So I think what point Hank made in context of a specific health security challenge, I think government is equally sensitive, concerned and proactive in handling the economic crisis which is unfolding. It's not specific to India. See, we are in an interdependent world. Globalization has affected and has been part of our production chain, something that we celebrated till few months back, and now we think that we all should be self-reliant. I think time has come, and I must congratulate the government in terms of thinking of the SARC as a starting point. So Prime Minister's effort in terms of handling the expertise that we have, the goods that we have, I think this is the time for economy to invest more on global public goods that are required in terms of continuing the process that is required. Of course, due care is to be taken, but I think economy is being paid attention in the fullest manner that the government can do at this point. And definitely on your point of disruption in supply chain, as I said, automobiles, the pharmaceuticals, software industry and supply of hardware, all the 4 sectors, Niti Aayog has already drawn out a major roadmap on this. The Vice Chairman Niti Aayog has been actively working out details of this with the Finance Ministry, and then are the 7 ministries, including the Ministry of Small and Medium Enterprises, which have been made the fulcrum of this revival process, along with the adjustments of the debt that the companies are ending up with. So this is a very tough time, and we are already seeing the efforts being made.
Okay.
There are 3 goals, I think,
yes, please.
To add to what Sachin ji has said. We must recognize that at this point in time, at the macro level, the big macro level, we have 3 goals. First, protect lives, save lives, and there is no question about it. Second, protect the interest and well-being of the poor. And then, in consonance, protect our economy, protect our growth, and to make sure that we compensate, we are able to respond to all these 3 challenges.
Yes. Ambassador Prakash, you wanted to come?
I completely agree with that at the moment the challenge is to protect lives, protect health, well-being of the people, but the economic dimension, from what I've been reading and talking to people, is going to be, it seems that going to be huge. Let's try to put a number to it. The global GDP is about $87 trillion, and it seems that this crisis will last at least for a few months. So, and the global economy, the world economy as it is, was facing headwinds. Now, if at a conservative estimate, there is a 0.5% contraction, although the estimate is between 0.5 to 1%, we are looking at a global contraction of close to $1 trillion, $870 billion or around $900 billion. So, it is going to be a serious contraction, and a recession is already being spoken of. The D word nobody is talking, and rightly so. And it's in addition to these 4 sectors, it is the transport sector, it's the hospitality sector, it's the service industry. Everything is going to be impacted.
We will talk about the blueprint in place, because now this coronavirus, the whole narrative is not only confined to precautions and not panic the health aspect of it. It's gone multi-dimensional, the diplomacy, socio-economic, education sector, much more. Coming to the education part, I'm coming to you also, Dr. Hendrik. But ma'am, there is this lot of debate going on, a certain sense of panic one can sense when it comes to en masse testing. Is that really required, or should testing be just confined to those who are showing symptoms with a certain travel history, etc.? Prime Minister yesterday said it very clearly, do not put pressure on system, but at the end of the day, be very, very particular and careful about your health. It starts with you. But UNICEF's assessment so far, in terms of testing infrastructure available, I'm talking about pan-India. What is UNICEF's assessment?
So that I'll actually ask Hank to look more into, because but I would just like to draw on the economic impact on it. Because how does that translate into the life of the child? So the child is at home, school is going to be closed for a while, movement is going to be restricted. At the same time, some parents might not be working. Either they're having to work from home, in which case we're lucky, but some parents, like even the Prime Minister highlighted, that the daily wage earner, the informal sector worker, if they are at home, what does it breed? When you're without work, when you're worried about your family, it breeds anxiety.
Yes.
It breeds panic, not just about the virus, but what's going to happen? Where will I get the next meal from? And I think that's where having from the very start this focus on the economic package, looking at social protection measures for children, for the poor. Now India has a great existing system of schemes for children, for elderly, for the most vulnerable. What's our opportunity now to see how do we make sure that it definitely gets to those who need it the most? And without, getting into delays in structures and systems, but I think there is the ability or there is the capacity for us to be more agile and adaptive in bringing those changes into place.
If you could also elaborate a bit on UNICEF's role here under different verticals. For example, the information, fake news, dealing with misinformation, that's very, very crucial, especially when we talk about children, extremely vulnerable bracket. And there is also the sense of mental anxiety when you have to tell the child you have to wear a mask or sanitize. Is it essential, first of all? Let's understand. For the parents, what would you like to say?
So for the parents, firstly, it's essential. This information, this change in behavior, this adopting this behavior is crucial for parents, for families, for institutions, even in our own offices. When I've come here, you have a whole system in place to make sure that we keep our hands sanitized. For the children, it's also where do we find the reassurance? So, for example, how are we going to adapt our education so that children are still learning? What about the internet connectivity? Does everyone have it? What special measures are we putting in place? What sort of games can we have? We're probably going to see in all households, we're returning to board games. Ludo, Carom, things that we've played previously and have forgotten about. It's how do we keep the anxiety low, but also recognizing that there will be instances when anxiety is high. Where do we get in touch with? Who do we get in touch with?
And that gap in education learning that will come eventually. We don't know, are we looking at 1 month period, 2 month period, the schools and educational institutions are shut, the e-learning bit of it, and that's not something which is accessible to everyone. Yes?
So this is an opportunity to really fast track whatever initiatives we have for e-learning. How can we fast track them and be able so that even the poorest household, the children are not being deprived of it.
That's very important.
I think for UNICEF, the information, getting the messaging out is crucial. Having the whole of government response in I think our Ministry of Health is doing an amazing job of bringing everyone together, and really kudos to our colleagues. And that's where the Ministry of Education, the Ministry of Youth Affairs, Sports, how can they be also taking in what the ministries are going to take forward? It's really important that we see this as a total mobilization, but in a way that makes us think creatively on how to take it forward.
And it is, Dr. Henk, a total mobilization, so to say. The first question that I wanted UNICEF to react on it, but that's okay. The testing abilities, the laboratories, because I believe our government is already working on it in terms of roping in private players, also adding more laboratories in the current corpus that we have, the private laboratories. But where does WHO really come in place here? Your chief says that, I was just reading some research papers, I'll just quote him, test everyone who shows symptoms. But then here you have, you're looking at a population. If you start testing everyone, that's going to put unnecessary pressure on the system. What would be your advice, especially the current situation in India?
I think that there are several issues that we need to look at. We need to look at from in which stage the country is in the outbreak, and also the capacities available. Testing is of course extremely important. You need to know from what's happening. And I was very encouraged over the last days, and I was also been discussing with Dr. Balram from ICMR and also with the Ministry of Health. At this very moment, India is both in scope and in capacities they are increasing. The scope is widening. The scope initially was very much dealing with imported cases, and then from the index case to look at the contacts and looking at healthcare workers who were actually also dealing with the patients. But now I think the scope is now widening. And what's now happening is...
Are you saying that we're at the brink of stage 2 and not really into stage 3?
No, not yet. And it was very encouraging also to hear. You might have seen the results from the Director General ICMR. What they did from mid-February, they did some sampling of what we call severe acute respiratory infections, the SARI, and from the ILI, the influenza-like illnesses. And these were independent and not related to travel history or having been in contact with any known case. Now, these test results came out, and I think there were about 900 samples were taken, and it was done over a period of 4 weeks. And if I'm not mistaken, it was about 50 areas that they looked at, and fortunately they came out negative. So that gives us a bit of a temperature from what is happening in other places. But it's very important. We have continued the discussion also with the Ministry and also with the Director ICMR. And I think what's now going to happen, the SARI, the severe acute respiratory infections, more samples will be taken on a farmer's routine basis for people in the hospitals. So that helps us now because we have the imported cases as one phase. The second case is local transmission, when there's from the index case.
But where do you see the volume? Do you see more volume now here in the local cases, or?
No, the volume, I think in this case we need to start reflecting a little bit globally. I'm from a small country, 17 million citizens, the Netherlands, and we have 2,000 cases in the Netherlands. At this very moment we have about 200 cases here in India. And I think in India we are still dealing with the imported cases and some local transmission, and now making sure that you set up a system that you early start detecting, is there any community-wide transmission?
Yes.
Because then I go back to
that is what we have to stop.
The thing is, you need to detect it early.
Yes.
Because it might already happen. And here you come back to this is very important that you strengthen your surveillance system, the IDSP, the Integrated Disease Surveillance Systems program, and that you put up mechanisms.
You flagged a very pertinent point, making your surveillance system extremely robust. I'm going to have a reaction from Niti Aayog health representative, Dr. Paul, but before that, we're going to take a very short break. When we come back on DD Dialogue, we're going to now also focus on precautions, challenges, battling fake news. That's extremely crucial, and how India, under the leadership of Prime Minister Narendra Modi, is much ahead of curve in terms of dealing with the situation. There's absolutely no need to panic. That's what WHO and UNICEF representatives are telling us on this show. A short break. We'll be back with more. Please don't touch that remote. We'll be back.
Namaskar, this is Amitabh Bachchan. The novel coronavirus or COVID-19 disease can be stopped. Together, we can do it. All we need to do is to take some basic precautions. Whenever you cough or sneeze, always cover your mouth with a handkerchief or a tissue. Throw the used tissues into a closed dustbin immediately. Don't touch your eyes, nose, mouth unnecessarily. Wash your hands with soap more frequently and for at least 20 seconds. Avoid participating in large gatherings. If you have a cough, fever, or difficulty in breathing, avoid close contact with anyone. Visit the nearest health facility or your doctor immediately if you have any of these symptoms. Cover your mouth and nose using a mask or a cloth at this time. For more information, contact the Ministry of Health